We begin with the latest on the coronavirus outbreak. I'm Kelly Eckerman. We've now hit 153,000 cases nationwide. New York is the epicenter of the U.S. outbreak, but federal officials say every state needs to prepare for the same crisis New York is facing right now. Karen Caifa has the story.
In Manhattan Central Park, the construction of a field hospital. In New York Harbor, the arrival of the USNS Comfort.
Help has come.
New York State has passed the grim milestone of 1,000 coronavirus deaths, and New York City says they'll still need to triple their number of hospital beds by May for COVID patients and patients not infected anywhere they can put them. The state with the worst outbreak in the nation and the peak yet to come.
What you see us going through here, you will see happening all across this country.
The federal government says every U.S. state and metro area should be prepared to face a similar crisis. Officials elsewhere, like Philadelphia, just 90 miles away from New York City, are eyeing that epicenter closely.
We have a very strong social distancing order for the city and for the state. Try to slow that wave and have it be as small as possible.
On Sunday, President Trump announced the extension of federal social distancing guidelines through April 30th. Still, the nation's top infectious diseases expert, Dr. Anthony Fauci, reiterating a bleak projection.
I don't want to see it. I'd like to avoid it. But I wouldn't be surprised if we saw 100,000 deaths.
Meanwhile, over in Europe, the death toll continues to climb. Italy passed 10,000 deaths over the weekend. Spain now well over 7,000. In Washington, I'm Karen Caifa.
Let's take a look now at the updated case numbers in Missouri and Kansas. Missouri health officials are reporting more than 1,000 cases and 13 deaths. Nearly half of the cases are in St. Louis. In Kansas, it's 368 confirmed cases and about 8 deaths. About a third of the cases are in Johnson County. Missouri Governor Mike Parson is making changes in order to provide more care to coronavirus patients. The state will now grant full reciprocity for doctors and surgeons. That means a doctor can be licensed in another state and still help people here in Missouri as long as he or she is licensed. Parson also wants to promote telemedicine across the state.
We've also temporarily waived a regulation requiring that a collaborating physician and advanced practice nurse be within 75 miles of each other. This will allow our health professionals to continue providing care using telehealth, which will help reduce the spread of the virus.
Kansas City Mayor Quinton Lucas says the city is going to crack down on people who are not social distancing. That means additional officers patrolling parks, and more community investigators will follow up on 311 complaints about businesses that don't comply with stay-at-home orders. Mayor Lucas also says it would help to have a statewide order to have people stay at home.
I have a significant concern, not just for Kansas City, where I'm mayor, but also throughout the state of Missouri, that if we don't take these aggressive steps now, you will see that sort of impact in communities large and small throughout Missouri. And I know much of the answer that the governor has had over time has been that, well, you know, places in the state are different. Kansas City is different than Poplar Bluff. But frankly, I think Kansas answers that point too. Overland Park is different than Goodland, Kansas, or Colby. But at the same time, we see that there is some need for consistent rules throughout our states.
Kansas has joined Missouri with a major disaster declaration. The president approved that move today. Extra funding will be available for state and local governments as well as nonprofit organizations. This is for areas who were hit by COVID-19 starting January 20th.